Hi, welcome to our video series, Caring for Patients with Infectious Respiratory Diseases. In this one, we're going to take a look at whether SARS CoV2 is airborne. Now, why you care about this is because this determines what type of transmission precautions people should take around SARS CoV2. Remember, SARS CoV2 is the virus that causes COVID-19. So we're going to talk about the precaution recommendations of the World Health Organization and the Centers for Disease Control. Take a look at this graphic in front of you. Now, this is the one that has all of us kind of awake at night thinking, how long can this coronavirus survive? Now, we're talking about the SARS CoV2. That is the virus that causes the COVID-19. So, we're looking at copper for 4 hours, cardboard for 24 hours, plastic and stainless steel 2 to 3 days. And here's the one that has our attention right now. Air for 3 hours. Now we know that small droplets can travel up to 2 meters and large droplets about 3 meters. But where did this number come from in the air for 3 hours? Let me show you. It came from a study in the New England Journal of Medicine. The title is Aerosol and Surface Stability of COVID-19 or SARS-CoV-2. compared to SARS-CoV-1. So you can take a look at this, see what you think, look up the article, but I'm going to break down some of the most important points here. Okay, let's talk about droplet versus airborne. Droplet are small but usually wet particles, meaning saliva or secretions. Now they can originate from someone who has respiratory symptoms from coughing, sneezing, or talking. Now these droplets can travel 1 meter or 3 feet. Transmission can also happen from fomites, and fomites are objects or materials which are likely to carry infection, like utensils or furniture or hard things like we talked about in the original graphic. Now, airborne is even smaller. In fact, it refers to microbes within the droplet nuclei. So we're talking less than 5 micrometers in diameter. Tiny, tiny, tiny. But these guys can remain in the air for long periods of time and are transmitted farther than 1 meter or 3 feet. Okay, so droplet, small and wet. They travel about 1 meter or 3 feet. We've also got fomites that can pass this on too. But airborne are microbes within the droplet nuclei, so they're much, much smaller and they can hang out in the air for a long period of time. Now here's the question we're all here for. Is COVID-19 or the SARS-CoV-2 virus airborne? The answer is airborne transmission may be possible, particularly in procedures or treatments that generate aerosols. So think about the types of treatments or procedures that will generate aerosols. Endotracheal intubation, bronchoscopies, open suctioning, giving a nebulized treatment, manual ventilation before you intubate the patient, turning the patient to the prone position, disconnecting the patient from the ventilator, non-invasive positive pressure ventilation, tracheostomy, and CPR. That's a lot of opportunity, right? The most important thing for you to remember is that airborne transmission may be possible. It's most likely in procedures or treatments that generate aerosols. Now let's go back to that study. Where did this 3 hours come from? Well, in this study, they used a 3-jet Collison nebulizer and a Goldberg drum. That's how they measured this 3 hours. The takeaway point is this is in a laboratory setting. This doesn't match normal human cough conditions. And that was a statement by the World Health Organization in their article on March 29th, 2020. So the study was done in laboratory conditions, not normal human cough conditions. So the World Health Organization takes this stance. Based on the available evidence, including the recent publications mentioned above, WHO continues to recommend droplet and contact precautions for people caring for COVID-19 patients. WHO continues to recommend airborne precautions for circumstances and settings in which aerosol-generating procedures and supportive treatments are performed according to risk assessment. So that is the World Health Organization's official statement, and I have the reference for you there at the bottom of the slide. Now, for the CDC and the European Center for Disease Prevention and Control, their recommendations are a little different. The CDC recommends airborne precautions for any situation involving the care of COVID-19 patients. And they say to consider the use of medical masks as an acceptable option in case of shortages of respirators like the N95, FFP2, or FFP3. So that kind of sums up the differences in the recommendations from the World Health Organization, the Center for Disease Control, and the European Center for Disease Prevention and Control. So let's review. Droplets are small, usually wet particles that contain infective material. Airborne particles are microbes that are tiny. They're less than 5 micrometers in diameter within the droplet nuclei that can remain in the air for long periods of time. The World Health Organization continues to recommend droplet and contact precautions for those people caring for COVID-19 patients. The CDC and the European Center for Disease Prevention and Control recommend airborne precautions for any situation, including the care of COVID-19 patients. So if you're following their recommendations, when you're caring for COVID-19 patients, you'll be following contact, droplet, and airborne precautions for all COVID-19 patients. Thank you for watching our video today, and remember, this is based on the statements in March 2020.